Okay. Welcome, friends. Welcome. I'm Jeanice Mitchell. I'm a pelvic health physical therapist, and today we're going to be talking about how to train your pelvic floor muscles so you can control, so you can poop when and where you want to, when and where you choose. So here's our little slideshow here. And you guys, if you aren't able to see this, just drop something in the chat box and I'm paying attention to that. So basically pooping when and where you choose, it sounds like a very simple concept, right? Like, hey, I grew up pooping when and where I chose. But when you think about it now, are you able to? Are you having difficulty emptying? Are you having difficulty with control? And so those are the two big themes that we're going to be talking about today. Keep in mind that I'm a physical therapist, but I'm not your physical therapist. This information isn't specific healthcare guidance or medical information for you. It's intended to increase your awareness and also to help you identify when and where you may need to get help. Always check with your doctor first if you're pregnant or think you have an infection before beginning any program. Here are some red flags to really be on the watch out for. So unexplained bleeding or pain, trauma or fever, chills or night sweats, unexplained weight loss or weight gain, altered mental status, like not being oriented to person, place, and time, and then depression or suicidal thoughts. I know I'm just spinning over those so quickly, but each one of those really, if you have this and you're having bowel issues, I really encourage you to get checked out by a qualified healthcare provider. In our outline today, we have 9 categories, okay? So first, we're gonna go over the anatomy, common issues, the digestion phases, what to poop, how to poop, when to poop, constipation tips, bowel urgency tips, and then lastly, pelvic floor muscle tips. This digestion phases, I mean, honestly, each one of these categories could be its whole day of a workshop. So this is very much just a summary of the information that's out there and kind of to pique your interest and to identify, again, when and where to get help. So when we eat, basically it goes into our mouth and comes down, and this is our small intestines, and then this is our colon, our large colon. So the ascending colon, the transverse colon, the descending colon, and then it comes out your rectum. What's not pictured here are the pelvic floor muscles right there at the bottom of your anus and your rectum. So here's an image, again, kind of blown up. This is what I really want you to focus on: the ascending colon, the transverse colon, the descending colon, and then it comes out the rectum. So if you can walk away today with understanding that anatomy and that your pelvic floor muscles are here at your rectum and around the anus. And of course, we're going to show the pelvic floor muscles. So this would be the pelvic floor muscles that you're looking at when you look into the pelvis. If you imagine the pelvis is kind of like a bowl and you're looking into that bowl, you have the pubic bone in the front, and this is the spine. Here's the bladder, the uterus, and the rectum. And these are your pelvic floor muscles. You have multiple pelvic floor muscles and multiple layers, and the pelvic floor muscles have different jobs. So specifically, regarding the rectum and the anus, you have some muscles that wrap right around that external, they're called the external anal sphincter, so wrap right around the anus, and then you have some deeper pelvic floor muscles too that help. So here is a side view of the pelvic floor muscles. This would be a female body cut in half from the front to the back. Here's the belly in front, and then this is the tailbone, the spine going up. Here's the buttocks. Pubic bone, this is where the pelvic floor muscles attach. So they attach right there, and then they extend back to the tailbone. Here's the bladder and the urethral canal for urine to exit. Uterus and the vaginal canal, sex and childbirth and menstruation. And then we have the rectum and the anal canal. And so this is where solid waste, liquid waste, and gas exit. Okay, so here is the anatomy externally. So this would be looking into the pelvic floor from below, like if you were at somebody's feet. So these are the buttocks, this is the pubic bone, that's the clitoris. This is the urethra for urine to come out. That's the vaginal opening. And then this is the anus. And the smooth area of skin in between the vaginal opening and the anus is called the perineal body. And then here are your labia majora on the outside, and then the labia minora on the inside. Here is the pelvic floor muscles with the skin taken off. So first I'm going to actually pause this animation just to go over the anatomy. That's the tailbone, and then this is the pubic bone. Okay, so that's the anus, that's the vaginal opening, the urethra opening, and the clitoris. And you can see all of these pink structures are pelvic floor muscles, and they wrap around that anus. So today we're talking about poop. So I really want you to visualize this. So watch what happens during a pelvic floor contraction. It does not seem to be playing very well. Let me go back and let's go into it and see if it does then. It is frozen. Basically what happens when your pelvic floor muscles contract, they close the anus. And that's one of the best ways to find your pelvic floor muscles is to take a mirror or take your finger, put it on the outside of your anus, and either watch what's happening to the anus or feel what's happening to the anus. So when you squeeze the pelvic floor muscles, the anus should close and kind of pucker, kind of pull up and in. And then when you relax, vice versa. I'm going to stop sharing just a minute here to make sure that we don't have all the technical side is going well. So excellent, because last time we had a little problem with that. So it helps me to just make sure everything is going well. Okay, so that's the pelvic floor from below. And then this is, it's just not playing. My videos, my animations aren't playing. So basically when those pelvic floor muscles relax, let's stop sharing here since it's not working. So when the pelvic floor muscles contract, that anus closes. And when the pelvic floor muscles relax, the anus kind of softens and relaxes. Okay, so that's an important thing. Okay. Good. So I am gonna answer questions here. So at the end of each section, and I'm here at the end of the anatomy section, I'll take some questions. So you can either drop it in the question box or in the chat box. So this comment or question is, it's so interesting with the tailbone. I had always heard your tailbone doesn't do anything, but if you fracture your tailbone, it seems like your pelvic floor muscles would be altered, and you're absolutely right. And that is, so here we are, let me share it again. So you can see that the pelvic floor muscles, this is called the anococcygeal raphe. It's kind of like a ligament that attaches the muscles to the tailbone. And literally, if you took your finger and you found your tailbone and you tucked it in, you tucked your finger in just a little bit to the bottom of that tailbone, and then you contract your pelvic floor muscles, you'll feel that tailbone move just a little bit. It's not going to move, well, in my animation, it moves quite a bit. It doesn't move as much as the animation shows, but it definitely moves. And when you're birthing the baby, if you had a vaginal delivery, then that tailbone needs to kind of move out of the way. And the tailbone can be fractured or dislocated during childbirth. Okay, so let's see. I saw someone raise their hand, but I don't really know what to do with a raised hand. So if you would just drop any comments or questions in the chat box. I'm going to be monitoring the chat box and also the Q&A. Okay. So just any questions you have, I will, at the end of each section, I'll check them out. All right, now 2 primary categories that we see bowel health issues with. One primary category is difficulty with pooping. So that would be constipation and straining. incomplete emptying, hemorrhoids or anal fissures, pelvic organ prolapse, which is rectocele, and then difficulty with control. So bowel urgency, bowel frequency, bowel leaks, and pelvic organ prolapse. Now, why do we have issues? You know, there's a variety of issues. And so I would encourage you to jump into the first series to watch, you know, all the different changes that happen to our pelvic floor muscles in different stages of life. But just a reminder here, a vaginal childbirth, vaginal delivery is a huge event for your pelvic floor and those surrounding structures. So here's the baby, here's the pelvic floor muscles, that's the vaginal opening, and then here's the baby crowning. And look at those pelvic floor muscles. They stretch up to 4 times, almost 4 times the length of, you know, a regular skeletal muscle. And most muscles would rupture before they got to that point. I do see some questions, so I'm going to get through this section and then I'll open that up. So during a vaginal childbirth, commonly there's tearing. And so the tearing would be in this perineal body. It can also go into the vulva, into the vaginal canal. It can go up towards the urethra and even up towards the clitoris. And then here's a little sketch of the perineal tears. So this would be no tearing. That's the vaginal opening, and that's the anus, and this is the perineal body. Here's a grade 1, a 2nd degree tear, third degree tear, and then this would be a 4th degree tear. And something that really is important to think about with 3rd degree tears, that tear is going into the external anal sphincter muscles, okay? And then with a 4th degree tear, that's going into the inner rectum there. And so it's these 2 types of tears have quite a bit of sphincter, anal sphincter involvement. There's also some statements out there and some conversation happening that a lot of grade 2s, like this is a grade 2, and this is a small grade 2. There are grade 2s that go right up to the anal sphincter or the external anal sphincter. But there are some times that grade 2s are being categorized, they're really grade 3s. So, and there's a lot of different reasons for that. Maybe the provider didn't know that it was a grade 3 and that it had torn any of the external anal sphincter fibers. So anyways, if you had a severe grade 2, it's possible that it's in some cases also involved and went to a grade 3. Here's this female side view again, and I want you to look at the rectum here. And this is the vaginal canal. And so this is the posterior vaginal wall. And here is the rectum, and this is called a rectocele. So basically where that rectum is starting to kind of drop into the vaginal canal. And if you can imagine when you're pooping, that is going to be difficult potentially to empty that area. Poop can get pocketed or stuck there. Healthy pelvic floor muscles do the right thing at the right time. So we want them on when we want that anus closed, right? So like if we're jumping or laughing or walking around, we want the pelvic floor muscles engaged to keep the anus closed and to keep the rectum tight, right? Kinked off. But when we want to pass gas or we want to poop, we want those pelvic floor muscles to turn off and relax and lengthen to let gas or poop come out. And again, it just doesn't look like my animations are working. So this is that animation again. And it was a fun animation because it shows you gas coming out. So I just think it's fun to be able to see the anatomy. But basically, if you can just envision that, let's stop sharing. If you can envision there that anus is softening and you have gas or poop coming out. Okay, so this seminar, this workshop, I'm going to answer questions that are related to the content that I'm covering right now. So it's a good question about what exercises can be done for pelvic pain while pregnant, but that's not the topic for this workshop. So you can connect me, direct message me or email me, and I can give you some resources. So a coccyx injury could ultimately affect bowel function. Yes, you're correct. Because because, there's multiple factors there, but one big factor are the pelvic floor muscles. And so a lot of times, like even if you didn't have an injury during childbirth, or even if you've never had a baby, but you had a hard fall and you landed on that tailbone, you stepped off a curb and you landed on that tailbone, that can definitely affect bowel function. Great question. Okay. So now we're going to go through 4 phases of defecation. So defecation is the medical term for pooping. And this could be its whole workshop. I'm going to just summarize what the pelvic floor muscles are doing in each of these phases, because that's the primary premise behind the workshop today. So the basal phase, the pelvic floor muscles are active. And the basal phase is basically what you're doing all day, every day when you're not wanting to poop. So like right now, I'm in the basal phase and you're in the basal phase, unless you're watching this while you're on the toilet. So basal phase, the pelvic floor muscles are active and engaged, and they're closing off that anus. Pre-expulsion phase. So basically this is where you feel, okay, I feel the need to poop, but you haven't actually made it to the toilet yet. Okay. So your muscles, you have your deep pelvic floor muscles called the puborectalis, and you have the more superficial muscles called the external anal sphincter. These muscles are still engaged to help keep stool in. We don't want it to come out yet in the pre-expulsion phase. Now you have the expulsion phase. So this is, I think, pretty self-explanatory, but basically in the expulsion phase, you want those pelvic floor muscles to relax. You want the anus to open. You want the poop to slide right on out. And then termination phase, slowly returning back. So the puborectalis, that deep pelvic floor muscle, engages again. The external anal sphincter muscles are involuntarily contracting to kind of close the anus and reverses the pressure gradient. And here, if you see this, you can add a voluntary contraction at the end. So sometimes your body does that naturally. Like when you're done pooping, your muscles might just kind of squeeze up and in, and that's fine. But some people find that it's helpful to actually squeeze their pelvic floor muscles when they're done pooping, and that it kind of cuts off. Okay, we're done pooping. Now we want to go back. We don't want poop to keep coming out if we're not on the toilet. All right. So I'm going to stop sharing and let's see if you have any questions so far about that content that we're covering. Okay, good deal. We'll keep going. So now what to poop? There's a whole stool chart called the Bristol stool scale. And grade 1 or type 1 is like pellets, like rabbit pellets. Okay, so if your poop is like rabbit pellets, it's going to be a lot harder to get it out, right? But if your poop is like liquid, like frothy liquid, it's going to be a lot harder to keep it in. So frothy liquid is a 7 on the stool scale, and 1 is that pellets. And so the ideal type is like a 3 to a 5. And that would be kind of like a squishy banana. It just kind of slides out, but it does have some form and texture to it. So some tips on how to get that poop to where we want it to be is to eat fiber. Generally, for most adults, it's 25 to 35 grams of fiber a day, but double check, with your provider and make sure that that's a good recommendation for you. But fiber is healthy, and we need the fiber to keep the poop moving. Stay hydrated, because if you eat fiber but you don't have water to help keep that poop moist, then that's not going to be any good. Stay active. Now imagine this. So if you've ever had a dog or been near a dog, when you go outside and you walk the dog, what happens? The dog poops, right? So the same concept happens with us. We need movement. We need to stay active. And if you're having a difficult time pooping, maybe going on a walk or doing some exercises might be a good idea. And then stress management. This is so important, and especially with COVID and everything we have going on. I feel like everyone's baseline stress level has just exploded, right? So managing your stress, and there's so many different ways that people can do that, but I encourage you to explore that option. And I'm going to stop sharing because we have a couple questions, maybe. No? Okay, I see raised hands, but just if you could type your questions into either the Q&A or into the chat box, and I will answer them as I'm able to. Okay, now we're going back to, so we covered what to poop, and now when to poop. Your bowels love regularity. They love routine. They love a regular cycle. So stay regular. The second tip here is listen to your rectum. This is kind of a funny story, but I think it helps to drive the point home. I have 3 children, so they're 15, 19, and 21. Whenever, even since they've been little, because I've been a pelvic therapist their whole lives. My son is 21, and that's how I became a pelvic therapist. So whenever they come to me and they say, Mom, my stomach is hurting. Mom, my stomach is hurting. I'm like, you have to poop. 99.999% of the time, I'm right. So a lot of times I think in our busy lives, we don't even recognize what the signals are, the signals that our bodies are sending to us of how, of needing to poop. So really getting in tune with your body and listening to your body. So listen to the rectum, and especially if you have children or teens, a lot of times they're just putting off those urges because they want to keep doing what they're doing. They want to play. They want to do whatever, whatever fun things. Who wants to go sit on the toilet? So encouraging your family too, to listen to your rectum, and different people have different signals, but listen to your rectum. Another tip here with listening to your rectum is gas. So if you're having a lot of gas, chances are you may need to go sit on the toilet. All right, so some tips if you're having a difficult time pooping or kind of getting into that regular cycle. There's something called the gastrocolic reflex. And so basically, this is a reflex in your body that kicks in 20 to 30 minutes after you eat. So after you eat is a really good time to go poop. Does that mean you have to use it? No, but if you or a family member are trying to get into a regular routine and you're struggling to hear those messages, just knowing that, hey, when I eat 20 to 30 minutes later, that there's increased colonic activity, and that's a good time to poop. Abdominal massage. I have really on a lot of these things, I have whole handouts and videos on each of these, but basically remember that ascending colon, the transverse colon, and the descending colon. So with the abdominal massage, you're starting at the bottom of the ascending colon and you're massaging up and across and down. And that is really helpful for a lot of people. Is it a guaranteed magic cure that if you do an abdominal massage, you're going to poop? No, it's not a guaranteed magic cure, but it does help a lot of people. So if you're trying to use this and train your body to get into a regular routine, I encourage you to check out the abdominal massage and be near a toilet when you're doing it. So don't do that when you're right about to leave the house and you don't want to poop. Stretching. So doing different stretches that help to stimulate the bowel. You can do stretches on top of a physio ball. That's helpful. And then also digital stimulation. So basically inserting a finger into the vaginal canal and kind of pushing back on the rectum. Like sometimes if you have a lot of stool in there, you'll feel it. And if you kind of move back and forth, sometimes that touch and that stimulation can help poop. And then ultimately, there's a lot of people that actually need to use a finger inside the rectum to help pull the stool out. Hopefully you're not at that place. A lot of times that's more with the immobile seniors that we might have in nursing homes and that kind of thing. But there's also other populations that benefits as well. So again, this would be something to talk with your healthcare provider about, but just understanding that getting into a regular routine and a regular rhythm is very important, and there's different tips to help you do that. Okay, how to poop. So we want those pelvic floor muscles to relax during that expulsion phase, right? So it's the puborectalis and the external anal sphincter. There's healthy IAP. So basically what that means is intra-abdominal pressure is IAP. What we don't want to have happen when you're pooping is that you're straining and you're holding your breath and your eyes are bulging like that. Okay, so that's not something that we encourage as good pooping mechanics. But you do need some pressure to help kind of move the poop out. So if you think about like a beach ball in the belly, so you're taking a deep breath in, and as you're exhaling, like make noises, so that there's air flowing, or you can do grrr. Basically your belly is contracting. You do have that increased intra-abdominal pressure, but you also have that airflow happening. The toilet posture is very important. So getting those knees above the hips, getting more into that squatting position. When you see a toddler behind a sofa squatting down, what do you think? Right? They're pooping. So it's the same concept. Getting into that squatting position has been shown to be more effective to poop. And then avoiding that closed glottis. Okay. Let's see. I think, a question here. There is a portable squatty potty, and I actually have one in my closet here. So if you want to wait for the end, I'll actually pull it out and I'll give you a demonstration of it. And I got it on Amazon. So squatty potty does have a portable option, which is really, really cool. And it's lightweight, and you can just put it into your suitcase. A great question. Okay, so now we're going to go over some tips. If you're having difficulty emptying, these are some good tips in general. Okay, so stay hydrated, fiber-rich diet, and a lot of these we've already talked about. So this is kind of a summary. Exercise, relax the pelvic floor, keep breathing and don't strain. Don't ignore the urge. Have a good daily routine, use that gastrocolic reflex for training, abdominal massage, get into that squatting position for toileting. This is something we didn't talk about, splinting a rectocele. I'm going to come back to that one. End with a pelvic floor squeeze, and then there's people out there that can help you with this. So this is a lot of do-it-yourself information that I'm sharing, but I'm a pelvic physical therapist, and this is what I specialize in, and there's a lot of us out there that can help you. So I would encourage you that if you've tried some do-it-yourself things and you're not seeing the results that you want, to go ahead and get some professional help with somebody that specializes in this. And then also talking to your healthcare, your medical provider, because ultimately there may be some things like Miralax or some laxatives or other things that may be helpful in the short term, to help you poop. Now, let's talk about splinting a rectocele. So basically, remember that here's the rectum, and that's where the poop comes out, and you have that bulge that's kind of pocketing stool there. So basically taking a finger or a thumb and either putting pressure, like putting that inside the vaginal canal and then kind of pushing back, or on the outside of the perineum, that smooth area of skin, and kind of supporting there. A lot of times that can help with emptying if you have a rectocele. Okay, and this is the written tips to go along with that. And then if you're having a difficult time with control, so number one, stop the activity. So if you're washing dishes, just stop. If you're on a walk outside, just stop. Whatever you're doing, stop. Take some deep breaths, squeeze your pelvic floor, put some pressure on that perineum. So that smooth area of skin in between the vaginal opening and the anus, press up and in there if you can. Take your mind off of it. So when I say squeeze the pelvic floor, these are like Kegels, but you're doing a strong squeeze. And to be able to do this, you've got to make sure that you're correctly squeezing your pelvic floor. So that's a foundation to squeezing, making sure that when you squeeze, you actually are squeezing the right muscles. Mental distraction, taking your mind off of it. And then telling yourself, I know I can hold it. I know I can hold it. Or whatever mindset mantra would be helpful for you, but saying that over and over. Keep an eye out for what you're eating and drinking, because there are things that can irritate the bowels. A lot of times people use coffee almost as a laxative. Like, I've got to have my morning coffee before I poop. And that's okay. If that's working for you, great. But let's say you're having difficulty with control and you notice that difficulty with control every time you drink coffee. Well, maybe that coffee is causing you to have kind of irritated bowels and causing that urgency. Does that mean you have to eliminate the coffee? No, but potentially reducing the volume and spacing it out. And more than anything, this information is empowering. So understanding, okay, when I do this, this happens. When I do this, when I eat this, then I have to poop. When I eat this, I can't poop, whatever it is, but understanding the cause and effect between what we do, what we eat, and we drink. And then ultimately training to hold on. So there's something called a bowel retraining program that we use a lot in physical therapy. And so basically it's finding out where you are now. And let's say you can hold it 5 seconds from the urge, from the time you get the urge to the time you go. And we want to increase that time, right? Because how much is 5 seconds? You're probably going to leak before you get to the toilet. And so adding time on, and adding strategies on to help you hold longer. That's the goal there. Now, pelvic floor muscle tips. So I've kind of broken these down into 2 categories: overactive pelvic floor muscles. And so if the overactive pelvic floor muscles, those are the pelvic floor muscles that are just kind of tense and holding on all the time. So for these muscles, we want to train them to let go. And then underactive pelvic floor muscles. And so these are the muscles that may be kind of lengthened and not very active. And so training these muscles to engage and to control those outlets. And so I have a couple pages of tips for each one of these. So overactive pelvic floor muscle, I'm sorry, underactive, my little menus covering that word. So pelvic physical therapy, here I am to help you. Identifying the cause. Was it childbirth? Was it menopause? Is it estrogen? There's so many variety of factors. Again, look at part 1 if you want to hear more about that. Maximum voluntary contraction. So when we go to the gym and we're training, let's say we want to bulk up our bicep, are we just going to do little baby contractions and not use any weights? No, we're going to do strong, hard contractions, and we're going to push those muscles, right? So we're going to push them in terms of how strong they're contracting. We're going to push them in terms of how long we can hold it and how much weight we can hold. So we are really working on applying those same concepts of strength training to the pelvic floor. For both of these, healthy bowels and healthy bladder are very important. There's something called electrical stimulation. So this is something you may have seen, like after, if somebody, let's say somebody has a knee injury, and there are those patches that they put onto the quadricep muscle to help kind of stimulate the muscles and help wake them up to get a better, stronger contraction. We can do the same thing with the pelvic floor muscles. And that's been shown to be very effective for fecal incontinence, which is leaking of poop. Stimulate or simulate activity. So I think too many times there's been, especially like, okay, you work on a training program, but you're doing it when you're lying down. Okay, well, that's okay at the beginning, but we've got to get you up and simulating what you're doing in your daily life to make that a real functional program. Biofeedback is kind of like an EKG of the heart, but it's an EMG of the muscles. And so it can kind of help to see what your muscles are doing, because these are deep muscles inside our body that you can't see, and it's difficult to connect with them sometimes. So biofeedback can be a great option for a lot of people. Vaginal weights can also be a great option. So those are some of my top tips for underactive pelvic floor muscles. And then overactive pelvic floor muscles, we have pelvic physical therapy, diaphragmatic breathing, stretching, identify the cause, quieting your nervous system, healthy bowels and bladder, training those pelvic floor muscles to release and relax and soften. And I have found that perineal massage can be really helpful with overactive pelvic floor muscles. So that's on the outside, and then also even doing intravaginal massage. So that is my presentation. Let me grab that portable squatty potty. And while I get that, if you guys have any questions or comments, just drop them. I think the chat box is easier because I can see it right there. Let's see. Okay. So here is, ta-da, the portable porta squatty. Okay, and opening it up, really lightweight there, and this is what it looks like. So it just kind of has these little hinges, and there you go. So it has a little warning on there that, you know, they don't want you to stand on it. So it's not meant to bear, you know, to bear your whole weight, but it's a great option to be able to take that traveling. I love that you asked that, Lisa. Thank you. Okay, so let's see about here in the Q&A box. Are there reasons for not moving through the 4 stages of defecation correctly? So can you just elaborate a little bit, Kate, on your question there? Okay, and I know we're nearing the end of our session. So my target time for this was 20 to 30 minutes, and we're at 36. So I'm going to be wrapping up soon. But if you have any questions or comments, drop them here. And if not, then I hope you can join me again next week. We're going to be talking about these same kinds of things, but we're going to be talking about pee instead of poop. So that'll be fun and interesting, and I hope helpful. I really appreciate each one of you joining. And okay, great. Well, thanks again thanks everybody. Oh, here we go. Let's see. So Kate, staying in phase 2 rather than phase 1 and feeling unable to do stage 4. You know, I really would need to dive into this a little bit. And if you want to email me or connect with me on Instagram, I'd be happy to. So I don't have a quick answer for your question there, and I'd like to get a little more depth into it as well. So thank you each for joining. I appreciate you being here, and